with Professor Jean Louis, and I invite you to listen to this session, and then we will have question and answer towards the end. Without further ado, Professor Jean Louis, please go ahead. And also thank you everybody for your continuous support and engaging in our lecture series. Voilà. Allez-y.
Thank you, Manaz. Thank you for inviting me to share a bit of our collaborative products, which is this lecture of implementation research. Welcome to everybody. I'm very pleased also to share some of my experience of implementation research. And particularly this session today, as Manaz just mentioned, will be about external validity. I'm going to share my screen. I don't know if you see my screen. Okay.
So yes, it's very clear. Please go ahead.
Yeah. So now we are going to discuss about applying the concept of external validity or transferability to implementation research. This is a key element of implementation research. You all maybe has already discussed about it during the previous lecture. So we will cover the concept of external validity, but more specifically, the factor can strengthen this external validity, but also the second part will be some exercise, some practice on how to assess the external validity. So the objective of this lecture, by the end of this, we will be able to describe the concept of external validity and identify stress to external validity and also factor that can improve it. And in the second part, we will do some practice exercise on what is going on. So first of all, let's go on what is really external validity. What is validity? Validity refers to the extent of concept, measure, or outcome that approximates the truth. For example, if you have to validate as implementation study, which is a quantitative or qualitative measure of acceptability by community members to use insecticide-treated nets for malaria prevention, the external validity will be the extent to which that quantitative or qualitative measure of acceptability truly captures the perception of the community's members regarding the insecticide-treated nets. And external validity is really a subset of the validity. It refers to the extent of which an observed causal relationship found by the study between a treatment and an outcome may be generalized to other settings other than the setting where the causal relationship was first observed. Sorry? Is there a question?
Can I ask everyone to mute yourself when you're not speaking? We can hear background noise. Please, everybody, mute yourself. Thank you.
A second example I can give is maybe about the community-directed treatment of onchocerciasis controlled in rural areas. The external validity will be of that research. Finding will be the extent to which the same cause-effect relationship between the community-direct treatment of onchocerciasis control can be approximated to other settings. So the assessment of external validities allow us to determine the relevance of research finding from one setting to another and facilitate the translation of research evidence to practice or policy broadly, compared to the efficacy research. For example, the efficacy research is when you're testing an intervention and we provided evidence-based information that this is working. So external validity is a bit different because it's really looking for the implementation process in real world condition in one setting could be different to another setting. So there's also the terms of Viable validity can be used as well. This is sometimes used to emphasize the bottom-up approach to look at the feasibility of, for example, using the stakeholders, how really all these bottom-up approach, the partners, the community, and the stakeholders could be working on to see if an intervention program is really practical, affordable, suitable, and available in a real-world condition. This is really the use of this external validity as a concept. You can see by external validity, we can also think about, as I said in the beginning, generalizability. We can think also about transferability. We can think about transportability. All these terms could be embedded in the external validity. Let's just go and dig a bit about these different concepts. First of all, the generalizability. Here you can see that generalizability is often used in a non-systematic fashion to describe the relevance of a specific implementation research finding to other settings based on a broad assessment of the contextual similarities between those settings and the settings where the study was originally conducted. So this finding can be generalized to another settings. These are another, and using this proximal similarity model, you see the model addresses the generalizability with regard to the settings, is how the setting is different to the where we conducted the studies, about the places, the location, about the timings, but also about people. All these concepts has been embedded into that model to see how your study can be really validated externally. This is a figure one. For example, an example we can use is if we evaluate the community direct treatment strategy for prevention of onchocerciasis conducted in a rural area, let's say in Niger, among older population or a lower socioeconomic status. So living in a close community during this raining season. So the researchers would like to generalize this finding from this study where it has been conducted in that particular setting of rural Nigeria. Can it be generalized if we do the same study in Indonesia, for example, where you have the different setting and in lower socioeconomic status, the people, the communities, the rainy season, the times. So these are the different factors that could be included in the generalized. The second term is transferability. About transferability, we can look at the outcome of a successful health intervention, evaluate in a primary context, can it be achieved in a target context? Let's say that to which evidence on the outcome of a successful intervention from this, what we say, a particular study area can be transferred to the target context. So it does this by collecting information on the three really construct the population, meaning the person, the environment, and the intervention, and how these three interact among each others to produce the outcome at a particular level. It could be the national level, it could be the subnational level, it could be also the regional level or the individual level. All these could be also, this is shown in, I don't know if you see my pointer. So these are the primary contexts where the study design has been conceptualized with the population, environment, intervention. And is it transferable? Is it when you transfer it in the targeted context, meaning, as I said, an adapted intervention, the outcome will it be the same at the national level, local, organizational, or individual level? And the third concept is after generalizability, after transferability, let's look at about now the transportability. So the transportability is whether the findings in one settings could be used to generate valid estimate in another. the prediction on how effective an intervention will be in a new setting based on an assessment of how similar or different that new setting is from the setting where the intervention was initially tested. So generalizability, transferability, and transportability reveal the different aspects of external validity that is really important to researchers, to practitioners, to decision makers, but also to all the communities. That's really important. And it is similar that the transferability framework could provide a formal mathematical approach, such as the effect of the intervention, as we showed previously, but also how we can assess the difference between the study population between the two settings, the target population, but also the based on what data is available. So after describing the concept of external validity, let's look about the stress that could be could blame a bit the external validity, but also the factor that could improve it. First of all, what stress can be addressed when you discuss about external validity? So there are stress that may limit our ability to generalize a study to a different context and be carried out in and then these can arise at 4 different levels. It could be the population, it could be the environment, it could be the intervention, but it could be also the outcomes. So if the population is really diverse or very different sensitivity to the health problem in question, it could really be a strength of the external validity. Or if the population is sicker, or the level of their engagement or involvement in the implementation. Similarly, the settings may also be more homogeneous, less diverse in its geographic, demographic, or sociocultural characteristics that are unique geographic, demographic, or sociocultural features that differentiate the settings of the choice of our original study context. If it's, for example, not random, for example, if you choose this area because we have 1 or 2 of these unique features. In the same vein, we can say also the intervention or the strategy developed without a strong conceptual basis or rigorous studies that could delineate its core element and mechanism for a specific population. And finally, the intervention or strategy could be linked to single outcomes, so measuring the effect of intervention, measuring the change in one parameters in clinical outcomes, etc., etc. And these are all stress that can really strengthen the external validity. Now, which factor can improve the external validity? There are key factors that can really improve that external validity of implementation research. You can see it could be also the preparation, looking for how we can identify the relevant stakeholders, and these stakeholders could really deeply involve in the planning, in the evaluating the evidence, and also their concern. It could be also the design, if you use a conceptual model with internal and external validity. So different contextual factors, different contexts for research, using mixed method, qualitative and quantitative. So the design also could help to improve the external validity. The participant, using a different representative sampling for the study participant, diversify the study participant in order to have subgroup for analysis, involve as many community members as possible, identify also and describe the characteristics of the target population, comparing the participating population to the target population, and analyze the difference between those two groups, but also those who participate and also those who refuse to participate in the study. Those are the factors that can really improve the external validity. including also the last element is the development of the intervention. So intervention that are based on scientific evidence that can publish in a peer-reviewed journal or use guidelines in developing the control program using the WHO, for example, guidelines, but also analyze the feasibility and also consider the cost. So preparation, a very good preparation, using a strong, rigorous design, a well-chosen participant, but also the development and intervention. Those are the factors that can really improve the external validity. It could be also other factors like how you implement your strategy, your intervention, using, for example, really meaning fidelity of what is proven already by your implementation, by your research. The outcome measurement, use easy to measure outcomes, not using very difficult indicators. Diversify your outcome, but also use multiple outcomes, and develop self-reporting by the population to really facilitate the sustainability of your evidence-based results and also your intervention. But also how you analyze your data, meaning applying rigorous method to determine the study effect, using subgroup analysis, as I said earlier, but also better analyze the different exposure levels, and also use very sensitive analysis is also another factors that could improve your external validity. But also the maintenance and sustainability, meaning how we can identify the system that need to be in place for studies to be disseminated and also maintain, obtain stakeholder input across the different levels of the studies, identify existing communication, and develop different products that can be used to describe the added value of the study to future adopters, to also the communities, the end users. So these are the factors that improve external validities. In summary, the take-home message of the external validity is it's really a key element of the implementation research study. It could be described as generalizability, transferability, and also transportability, how you coming from a particular context where you did the study, but where this study or these results could be generalized, could be transferable, and also transportable. And external validity also assessed through the population, the intervention, the location, the timing, the environment, but also the outcomes. And this assessment could facilitate the translation of research evidence into practice or policy, which is really the goal of implementation research. So
Great.
these are some references that can be used if you have time to look at it. There's some website and very papers published in that particular domain, and that could help for you to better understand what is external validity, what are the different factors that can really improve it, but also what are the threats of the external validities. So thank you very much for your kind attention. Maybe we can stand up for some question or go to the part 2. Okay.
Are we covering part 2 today as well, Jean Louis?
I don't know. If
okay,
you want,
no problem.
We can
have
plan
enough
for the
time
as well. Yeah.
Okay. I have a question. If nobody else, I don't see any hands on. Hands up? No, I don't see any. The question is that if we go back to the second last slide on the 4 elements of external validity, yes. So this is important that for when we design an implementation research, first, when we look at different implementation research approaches, Then it's important that in the internal validity that I think we covered last time and external validity, we cover this when we're going to publish our paper, because quite often the authors look at the journals, look at how vigorous our study is, correct?
Yes.
And,
yes,
and
exactly.
I can see that in the intervention implementation, the issue of fidelity came, and also different, outcome measurement. It's critically important that has been covered here, because we are recently reviewing all the theses of the students, and we
Yes.
noticed that quite often the theses are not very comprehensive. So now that we have these lectures, is an opportunity that different faculties, they can actually enhance the research projects that the students do.
Yes.
I hope I'm not asking too much, colleagues, but I think it's an opportunity here.
Yeah, I mean, that's really key what you just said. It's really important, and particularly for the PhDs or the master's students, to see how they can really take into account when they are doing the implementation research. So Gloria Sanchez has raised her hand.
Please, Gloria, please go ahead.
Yes, thank you. Good morning to everybody. My camera is not working. I don't see anyway.
No problem.
Gloria,
You can
I
ask.
hear you very well.
Yeah, that's fine. No, I think the discussion is very timely and important, because this is a learning process, We started coming from a different, actually, taxonomy concepts, but I think we have been to the point where we are making a consensus, and I'm very happy about that, in which we have like a more acceptance of the core knowledge that we are in the capacity now to use, I think. And this activity actually is very timely and very good for that reason. I want to point out is the terms, the difficulties to try to leverage and to balance actually sustainability, validity, and all the time we say context, context is very important. We have to think in context when we design our projects, but at the same time we have to think in the future. So how we make this transferable, how we make this scalable. That's a really challenge, because we have different contexts, but also we have I would say, still the models that are appropriate for our context yet. And I think that is a huge challenge. The conceptual models, the frameworks that we are using now, we intend to use, there are still, they were designed thinking in other contexts. And so one of the things that will be very valuable also to move the field in low middle income countries is to try to work out the adaptation of those models, the frameworks, but the development of the instruments to do the measurements, because that is a challenge that I think we will face. That we have not, in the case, for example, Latin America, we have to translate those measurements and the questionnaires and surveys, and we have to validate them. So it takes time, and the time frame to do a thesis doesn't allow you to do it, because doing that is itself a thesis. Doing the contextualization, the adaptation of the frameworks is in itself a project, and having the questionnaires and translations. So that's the point that I want to just leave, because that is central to validity, definitely, especially to external validity, the very good use of the frameworks.
Sure. Thank you so much. I think let's move to the next part 2, Professor Jean Louis, so that we have enough time to finish this topic.
Okay, so I'm gonna just stop sharing and
Okay.
दूधले त लाग्छ कफीले लाग्छ आज मलाई खाना पनि खानु रोटी छ कि छैन
Please, colleagues from Colombia, mute your microphone because we can hear someone speaking Spanish from the background. Thank you.
So now, I mean, the different knowledge we share could also help us to see how we can now really look at how we can determine the key elements for assessing external validity in implemental research. As just mentioned by Gloria, it's really important to consider the concept. And we will also look at the key elements for assessing external validity, but also do some practical exercise on external validity assessment. I was about to add one of my study of feasibility of integrated approach of mass drug administration of albendazole, praziquantel, and SMC drugs, but I mean, I do not have time to put that one, so probably we will consider using the schistosomiasis drug treatment as a practical exercise. So in this session, we're gonna go through a broad approach of assessing external validity and pose some guiding questions that researchers, practitioners, but also decision makers could really apply when assessing the external validity and finding of implementation research study, meaning intervention or strategy. So this approach is really based on 4 themes to consider evaluating external validity. It could be the unit of the study or the unit of the population. It could be the treatment or the intervention. It could be the outcomes, but also it could be settings or environment. I just mentioned Gloria. It's really important to look at the context. So units of studies or population, treatment or intervention, outcomes, setting or environment. So these tools has been developed and you will see in the reference, and you will be able to also to look deeply on that. Let's go deeply on the population, for instance. So these are a score that can be applied, and these are the questions you are being able to ask when you are assessing the external validities. For example, for the population, the first question is the population is diverse? Diverse meaning ethnically or culturally? Does the study inclusion criteria take into account the gender or other equity variants, meaning socioeconomic status? They are in the rural or urban area or peri-urban area, the place of residence, the race or ethnicity. Is the sampling adequate? How we sample the population is enough representative? Or does the study participant also represent the intended target population? So these are the questions that could be used in that grid to assess the population. About the intervention, the question will be, was the intervention developed based on prior evidence published in the literature or existing guidelines? Was the intervention delivered as intended? Manas was earlier talking about fidelity. Is the intervention suitable, meaning can it be continued given current arrangement with the health system? Is the intervention acceptable to stakeholders, so the different partners that are involved in that strategy, meaning the health system, the partners, the communities, etc. And are the comparison groups for establishing the effect of the intervention really adequate? You are those who are targeting for the intervention, are they really adequate? Meaning either the disease is here or what you are assessing, could it be really evaluated? And this is a score, you can score it, meaning if it, for example, if the study is conducted in the multiple or multi-level area, you can score 1. And if it's not, you score 0, etc. For each question, you can score 1 or 0 to see how you can assess the validity of these, the external validity. Let's go. Yes. We discussed about the unit of the population. We discussed about the intervention. For the environment, those questions also could be identified. Was the study conducted in multi-level area? Yes. Were all the relevant stakeholders involved? Do you really make a good mapping of the stakeholders? Were the contextual factors taken into account, meaning temporal, economic, political, or social? Was the valid contextual framework, meaning the considered framework on implementation research, used or not? Was the valid were multiple outcomes, meaning clinical, behavioral, implementation outcome, meaning cost, biological, etc., assessed? Is the primary outcome of the study is really relevant to the targeted participant and settings? It's really important to choose the good indicators. Was any self-reported implementation outcome by the population assessed during the study follow-up to assess, we are saying, the sustainability? Were the study outcomes analyzed for any dose response effect? And was there any subgroup effect or outcome observed? We talk about how you can, within your group, maybe identify the subgroup for the analysis. So the extent of which this implementation research study can answer yes to each of these questions could provide an indication of the external validity of that implementation research. And one can really assess the percentage of yes, along with the qualitative summary of the response to each questions, to present a report of the external validity of an implementation research study to the different stakeholders, including the decision makers. So such external validity assessment do not have to wait till the end of the study, but can be conducted before, during, and after of the. So the external validity assessment, you don't need to wait until the end. You can do it before, even during, and even after. So we can now start a bit of the practice using this grid of external validity assessment of population, intervention, environment, and outcomes. And we are using a case study, which is the activities done in Senegal. This study was published by Moussa et al. And the title of the study is really Effectiveness of Semestrial Mass Administration of Praziquantel, 600 milligrams in the schistosomiasis high transmission area of Senegal River Basin, by Moussa and Col. Moussa was working in the northern part of Senegal. And these are, when you look at the different elements to assess the external validity, look at the population as described by the study. So the study was conducted at school level with a very diverse population. Public school, so it's a free access. The sampling is adequate, targeting those primary and secondary school. However, some parents, because of the religious consideration, do not bring their children in the model school. They bring their children in the Quranic school. And this is really what we are seeing in many areas of Senegal. So as the intervention, meaning the mass drug administration of praziquantel, 600 milligram, is based on WHO protocol. It was delivered almost as planned, and it seems sustainable because it's still carried out in a regular basis. in many countries other than Senegal, in Mali and Guinea and Mauritania. And this is an intervention really very acceptable, really acceptable. And there was also a comparison group to look at the effect of that, because this is the effectiveness trial. For the environment, the study was initially not conducted in a multiple level areas. However, so relevant stakeholders was included, and it appears that a valid conceptual framework was not used, and the assessment tool were developed based on the WHO tool. So they use really the WHO guidelines. In terms of outcomes, several clinical or biological indicators were measured, parasite prevalence, for instance. The primary outcome of the study is relevant to the target population and settings. And however, any self-reported implementation outcome by the population was assessed during the study follow-up. This is really maintaining the sustainability. And the dose effect analysis was carried out. However, there was no subgroup analysis. These are really the how we can assess the XNL validity, and the other activities. I will ask you to assess this by putting 1 if the provision has been made and 0 if not. So using the figure we discussed already, these are the different characteristics of the population. These are the different characteristics of the intervention. These are the different characteristics of the environment, and these are the different characteristics of the outcomes. Okay, so are you with me?
I hope so.
Yes.
Okay, so let's go with the population. First, the first question is this study population is diverse, meaning ethnically or culturally? Is it yes or no? Hello? Yeah, I think yes. Yes, we mentioned that it's a diverse population. Okay. Is this study population also? Do we use study inclusion criteria that are taking into account gender or other equity variables, etc.? In this study, are the investigators taking into account the gender, the socioeconomic status, the rural or urban status, the race, the ethnicity, the religions? What is your answer?
Sarah says yes.
Sarah says yes, but it probably is not been described in the population.
Elena says yes, equal 1.
Okay.
But yes, it hasn't been described in details. Yeah.
So is the sampling adequate?
It does say the sampling is adequate.
Adequate, yes. Okay. And that the study population represent the intended target group? So we're targeting the school children, and we are talking about bilharziasis, schistosomiasis, and we all know that really the target population of those who are really suffering for bilharziasis, schistosomiasis is the children between 4 to 14. That are those who are really frequenting the rivers and so that are infected. So we can say yes, the population, yes, the school children is really the targeted group. Okay, so in terms of the population, we can say that we have yes for all, maybe except just one about the gender issue or other equity variables. The second group of question is about the intervention. So was the intervention developed based on prior evidence, something published or existing guidelines?
Okay, please unmute yourself and respond, colleagues.
Yes. Hello?
Yeah, can I try? Yeah, it said that they use the WHO tools that's already published.
Exactly, yes, okay. So was the intervention delivered as intended, meaning about fidelity? So it seemed that it's using WHO protocols, and it was delivered also almost as planned. Okay. Is the intervention sustainable? Yeah, we know that the health system in Senegal, in Mali, and Mauritania, and Guinea, every year they are organizing the campaign of mass drug administration of praziquantel against the bilharziasis, but also against others neglected tropical disease. Okay, is the intervention acceptable to the stakeholders? Yes, because we have the relevant stakeholders that were included and involved. And is there a comparison group? Yes, there was. You said that there was a group control. Okay, the villages were divided into intervention and control. So about the environment, so these are the first responses we got. Yes, we say from population we have answer yes, except for this one, yes and yes. For intervention also was yes, 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 sustainability, acceptability, and the group control. Okay. Let's go quickly about the environment. Was the study conducted in the multiple and multi-level areas? We hear they said that this was not. And let's go to the response. Firstly, yeah, the environment, we said no, because the study was conducted in 4 different villages, but there was no multiple level, meaning subnational, regional, individual. No, it was just in the village. The relevant stakeholders were included: health authorities, parents, guardians, communities. Yes. For the first one, was contextual factors taking into account, meaning contemporary, economic, political, social. So 0, because that was not indicated. What about the valid conceptual framework? It was not used. But it was not used. But the assessment tool, they use the WHO tool, so we can say yes, even though there was not a valid conceptual framework. And the last one, the assessment tool developed by WHO, we can say yes. So about the outcomes, multiple outcomes, we said yes, there was a clinical, biological, behavioral, there was a quantitative and qualitative assessment, so it's okay about the outcomes. The primary outcomes, it was really relevant to the target population. Yes. And after about, was there any self-reported implementation outcome by the population assessed during the study follow-up? It was not really no. And about also the dose response effect, yes, it was, because we measured the baseline before and after intervention. Yes. And about the subgroup analysis, there was no subgroup. They didn't mention looking for the effect on the girls or on the boys, under 5 or under 5 to 4. There was no subgroup analysis or by village to see if there's any impact on that. So these are the grid of how you can assess the validity, the external validity of a particular study. Just mentioning, though, taking into account in that particular study, the population, the intervention, the environment, and the outcomes. Okay? Any question?
Yeah, thanks.
Okay, I will give you another exercise. Maybe you can use it during your breaks. You can do it at your home to see how it can be applied. Is a seasonal malaria chemoprevention studies. SMC, seasonal malaria chemoprevention, consists of the administration of curative treatment of sulfadoxine, pyrimethamine, and amodiaquine, antimalarials, for 3 days to prevent malaria during the high peak of the transmission to children from 3 to 59 months. So this study took place in Mali, 200 kilometers from the capital of Bamako. And the aim was to determine the optimal approach of administrating SMC in a rural population during the peak of the transmission. So the study was conducted in the population, children 3 to 59 men in Sils area of Joila. The number of children included was 900 in total and different ethnicities. When you look at the intervention, these are how the intervention has been described. The environment of the 240 households in 6 health areas, and the outcomes is the following. Finally, they have a coverage of almost 99.7 children in the intervention group, while the standard approach gave around 90% coverage, and the DOT approach, DIT is direct observed treatment, was 95.5 coverage. So they assessed the feasibility and the coverage of the study. They found the difference in the coverage, while there was no difference in the effectiveness of the strategy. So we ask you to see if you can assess the external validity of this particular study before as a home exercise. So at the end of this practice, because we are almost approaching the hour, the take-home message for assessing external validity is the assessment of external validity facilitate the translation of research evidence into practice. It could be done before the study start, during and after, and really consider evaluating external validity of each of your implementation research project. Thank you for your kind attention, and please share any comment or questions into this practice.
Great. Thank you so much, Jean Louis.
Yes.
And particularly going through the examples.
Yes.
Do we have any questions or comments, colleagues? We have a few minutes before we close. Okay.
So I cannot read the message. Maybe
I am reading them. Everybody
okay.
says thank you so much.
Okay.
So people like your presentation, and even Professor Tobias has been recording your presentation. Yeah. I see colleagues from WITS joining us, from University of Antioquia joining us, some colleagues from Bangladesh, BRAC joining us, and some, Hosseini Dulu from Mali joining us, yes. And also, I don't see many people from Indonesia, probably it's too late for them. And also from Senegal.
Okay, we have a hand, Carlos.
One hand, Carlos, please go ahead. You're muted.
Yes, okay. Hello, everyone. Thank you, Professor Jean Louis, for your talk. I was thinking, listening to your talk, there is a concept in effectiveness, efficacy studies. It's about pragmatic trials. When usually we're trying to make efficacy studies more intervention more pragmatic. There is any relationship between external validity in the sense of in the field of implementation research and pragmatic studies or something related with pragmatism about that?
I mean, probably pragmatic studies are looking for efficacy results, efficacy studies, efficacy research, while really the external validity is really assessing use for implementation research, which is a bit different. Let me share.
Maybe we can do a little bit of literature review on this for next time as well, Carlos. It's a very good question. And I think we're running out of time now. I have to jump to another meeting very soon. Yes, very good question.
Can you give an example? Do you practice the pragmatic trials?
I don't have experience. Professor Gloria has experience here, but I was just looking at the assessment tool that you presented. There is an assessment tool similar to that one to see how pragmatic is the study, how much pragmatic it is, and it has to do a lot with the generalizability or the transferability of the results also in terms of effectiveness or efficacy studies.
Yeah, I mean, and it's really the objective really to see if your research, your results, your finding you get during your efficacy results could be transportable from the study, for example, in Indonesia. Is it applicable to the study in Nigeria or in Senegal to another context, another environment, another population, another timing? Those are different concepts you are using for external validity. For the trial, maybe it's sometimes more rigorously used for assessing the validity of a trial.
Perfect, thanks.
Yeah,
thank you all.
I mean, just like one last example is sure in the context, for instance, of the COVID-19 we had in the last couple of years, we are really seeing in terms of research how we can accelerate the process of one results of the trial can be quickly applicable in another context that really helps in the terms of acceptability, in terms of validity, and also using this grid is very useful because it could be done very quickly before, during, and after. But also sometimes we are using models, another tool to really validate some research findings. Over. Over to you, Manas.
Thank you so much, colleagues. Thank you, Professor Jean Louis, for the presentation. I thank you all for joining this session, and I hope to see you and more of you next week. And there will be a survey at the end of this lecture, which is very helpful for our presenters and also for us how to improve this lecture series. Please note that you don't need to record these sessions because I'm going to send you a link to the voiceover, which are for the time being in English, but we will translate them to other languages that you will have access to them. So thank you and have a very nice day or evening, everybody. See you next week. Bye-bye.
Thank you.
Bye, Jean Louis.
Thank you.
Au revoir.
Bye-bye.
Au revoir.
Bye-bye. Thank you.